Hey everyone, welcome once again to Healthy and Whole. My name is Melissa Adams and I'll be your host. The tagline or the title of the Healthy and Whole Summit is How to Live Your Best Life Now. Bringing all the different types of approaches and facts together so you can make the right decision on your health journey. Today I have Dr. Lela Iduna with me. She is a Yale trained medical doctor with almost 30 years experience. In the past 12 years, Dr. Lela has been passionate about functional medicine and the impact this root cause approach to medicine has on health. Through her functional medicine practice, Dr. Lela has helped many people get off their medications and completely heal their bodies and minds. She is truly making a difference and bringing healing to everyone she works with. Very warm welcome to you, Dr. Lela. Thank you for joining us today.
Thank you, Melissa, for inviting me. Glad to be here. What a pleasure.
Great. So you are still a medical doctor, or you just generally doing functional medicine practice right now?
I do one day of traditional medicine. I am my training was in the emergency medicine and internal medicine. Mm-hmm. So I still do one day in the emergency room.
Okay, great. And what led you to actually going for into the functional medicine industry?
Couple things. Well, first was that, after working in the emergency room for over 20 plus years, I realized that my patients are not getting better. It's few patients keep coming back, even though in the emergency room, you don't expect them to come back. And so I knew that whatever we were doing wasn't enough. It wasn't helping them. And then some of them were getting worse. So I wanted a better alternative to actually help them get healthy. Yeah. And I also, at about the same time, was having my own health problems with chronic pain and fatigue and fogginess. And in a typical traditional medicine way, I had blood work done and nothing came up. And so that happens a fair bit, if the disease is early enough or not clear diagnosis can be made, then there's no treatment. And so I was suffering and didn't have a treatment for myself. And so by the grace of God, somebody showed me the Institute of Functional Medicine. And that changed my life personally and also in how I serve other people.
Okay, wow. And what type of approaches do you use? Do you use diet, specific approaches, or is it all mental healing, spiritual healing, emotional, physical? Is it all rounded in terms of the functional medicine?
It is. So the basic way I would describe functional medicine is if you were to take a tree. And so traditional medicine is like spraying the spots on the leaves because it's a diagnosis and treatment. So functional medicine, we look at the roots and the soil. And the way I describe it is the soil is our surrounding, our toxin exposure, the virus or bacteria exposure. And then the roots is our own ability to absorb nutrients. Even if we are taking perfect nutrients, is the gut healthy and is the mind and the emotions healthy? So it's both.
So in discovering or trying to manage the root, which will help with the symptoms, obviously, how is the root actually recognized and how do you diagnose it?
So a few things. So the root is always inflammation, whether it's a common cold or diabetes or an autoimmune disease or even cancer and Alzheimer's. The body is the immune system is not functioning. It's not balanced. There's inflammation. So then we have to look for the root of the inflammation. Is it something in the gut that the person is eating foods that the body is getting sensitive to because they have leaky gut? Is it because they have toxins that are causing inflammation? Is it because they have chronic inflammation like Lyme disease or Epstein-Barr virus? Is it because their hormones are off and the body can't function? Is it because their neurotransmitters are off and there's no balance of the serotonin, the GABA, norepinephrine, so they're always fired up, and no matter what you do, they can't relax. So it's looking at all those things. And so I start with a basic, very basic blood work. I call it basic, not because it's few items, but it's a very wide panel. So it helps me focus on which of these things that I'm going towards would be helping, because it gives me a snapshot of their hormones, of their inflammation status, of their nutritional status. So if those look okay, then I need to go deeper and find other things. So that's where I usually start, is with the blood work.
All right. And in terms of treating whatever you've found, do you also use a type of elimination diet in terms of what they eat or what is not agreeing with their body?
Right. So sometimes we end up doing a food sensitivity test. And it's interesting. A person may think that they're eating a really healthy diet with fish and nuts and healthy fats. But if they have leaky gut, that very thing that they think is healthy is what's a problem for them, because they're losing all these protein particles through the leaky gut into circulation, and that's causing inflammation. So I've had patients that come in and say, I don't want to eat red meat, I don't want to eat chicken, I want only fish. And then we do a sensitivity test and they're positive. So then we have to switch the diet. So every person is very different in that. So I do recommend doing that. If people can't afford it, then we can do a basic elimination. There's usually big 8 is what most people call it. And those are the gluten, dairy, corn, soy, peanuts, beans, nightshades, processed foods. So those are the big 8. And we can start there if somebody has, we don't want to make it financially cumbersome for people, because that's stress and we're trying to decrease stress. We don't want to add stress. Yeah. And if they can afford something more specific, we would do a blood test and find that. But that is just the beginning, because when they have a leaky gut or food sensitivities and the inflammation is mounting, we need to curb down the inflammation. We need to give the body the nutrients that it needs. And unfortunately, only a third of what we take by mouth gets absorbed, especially if the gut is compromised. So in my practice, I also do IV treatments or IV therapies, which are tailored very specifically to if I'm treating inflammation, if I'm treating nutritional deficiencies, if I'm treating adrenal compromise, if I'm treating fatigue. Mm-hmm. So that I find that a very important part in my patients' healing. And I've seen it time and time again where patients don't go with that. It just takes longer and it's a slower process. We will eventually get there, but it's a lot more, it's a harder process.
So that where you said a third of what we take in is actually absorbed is actually quite a wow fact for me. And yeah, IV treatment does seem like the one that will help the body absorb more nutrients. So with me being in Africa, how would I know what IV treatment to use? Because I know that we do have a few companies that do that, mobile IV treatments. But what is best for me if I struggle with chronic pain?
So I would want you to do the blood work first and foremost, so we can look for the root cause. And then in that blood work,
look for in that blood work.
In that blood work, I can look for, are your adrenals functioning? Are your if you're postmenopausal, do you need other hormones that are causing pain or fatigue or fogginess? Are your nutritional status normal? I want to see what your vitamin D level is, what your B12 level is, what your folic acid level is, all those things, what your magnesium is, all those, because all those help the body function. What's your selenium, what's your zinc, because that affects your thyroid hormone. I would want a full panel of your thyroid hormone, all 6 things, because mostly people check for 1 or 2 things, but I do a whole panel of 6 things to see if every step is balanced.
Yeah. Yeah.
And so that's just a few things. And there's a whole list of inflammation markers, and different inflammation markers are specific for different things. Like there's a marker called LPPLA2, which is very specific for heart health. So if I see that that's elevated, I'm concerned about that person having compromise to the circulation of their heart.
Mm-hmm.
So then that's a whole different protocol that I would do called chelation.
Yeah, yeah. And if we want to diagnose something at face value, so if I'm in the gym and I'm busy picking up weights or just busy flexing, you know, and all of a sudden my muscle pulls stiff and it doesn't want to move, I would really think that that would be a lack of potassium in my body or magnesium.
Could be.
A few
Yeah.
thoughts beyond that.
Your hydration level, your nutrition level, and did this happen for the first time, or is this something you always have and you've been ignoring and now it's getting worse? If it's something more chronic, then I would look for something more chronic, like toxins, metal toxicities, chronic infections like Epstein-Barr.
Yeah.
Because they don't just happen one day.
Mm-hmm.
And many people, when we're younger, we are more gung-ho about, I can just push through this.
Yeah. Okay.
So
No,
different.
because I have a group with lupus diagnosed patients, and one of the common, or should I say, one of the common that happens quite often is muscle spasm, and we're not too sure of how to treat it because it just comes out of the blue. You know, I'll be sleeping in bed and all of a sudden my calf would pull stiff, and I have no idea why. And I think that's just one of the mysteries of lupus, being the imitator that hides behind everything, and just trying to help each other and how to make it better.
Well, I would definitely start with the magnesium, a lot of magnesium, because magnesium then helps the body to absorb potassium. And also vitamin D, because that will help your balance of your calcium. So I like my patients to have a vitamin D level of almost 80 or 90, really high.
Yeah.
But also, lupus is an autoimmune disease. So then I want to see, okay, why is the body attacking itself? What is triggering it? Is it food? Is it toxins? Is it infections? Is it hormones? Mm-hmm. So for every patient, I've had a few lupus patients here that had the Epstein-Barr virus, and we treated them with intravenous silver, hydrosol silver, and they have never felt before. Their numbers are normal. They don't have any, their ANA is negative, normal.
Wow. Okay.
Yeah.
All
so
right.
It's really
just working through the process and trying to get to the root.
And then the next step I do after that is I actually give them stem cells in the IV.
Yeah.
Then that helps the body rebuild the damage that was already done. And people are really, it's impressive. They say they feel young again.
Nice. Okay. Yeah. That's refreshing, I guess. With years of pain and suffering, and now all of a sudden you've got the energy of a 16-year-old.
Yeah, exactly. Yeah, definitely. Do you have people in Africa doing stem cells?
I think they should definitely be, but it's not spoken, I don't hear about it a lot. I'm sure if I go and I research, I'm sure there will be.
Because I definitely, so first treat it and then boost it with the stem cells.
And with the clients that you do have, what do you find is the common trend of treatments that need to follow, or the common aspect or the main complaint that they come in to see you? What is it?
Three common complaints: pain, fatigue, and fogginess. They're like, my brain doesn't work. I can't remember things. I'm always tired and I always hurt. And it's interesting. The fatigue is the one that gets them the most because people can sympathize with pain, but people can't sympathize with fatigue, especially if they are not able to function, because there's very little difference between fatigue and laziness. And often people are judged as being lazy instead of, wow, there's a real problem. I've had patients come to me crying because finally after the treatment, their spouse turned around to them and apologized that they didn't know that they were actually sick.
Yeah.
It's
Wow.
it's a big emotional drain, deep part.
No, 100% agree with you in that. Yeah.
Yeah. Yeah.
Dr. Lela, if there's one tip you can give to our listeners, if they are already suffering from chronic pain or fatigue or fogginess, or if they're not, what is your best advice you can give to listeners?
Prevention. Prevention is always better. And by prevention, I mean eat healthy, eat whole foods. I don't know about African diet, but in America, our diet is really very what I call pro-inflammatory, a lot of processed food. So I'm hoping you guys are better than us in that, and you eat whole foods, home cooked
Yeah,
meats,
I think we're
vegetables.
slightly better, but we all still love the McDonald's, the Burger Kings, we have them all, the Krispy Kremes, we have them all, yeah.
Poison. That is poison. And even like kids, even 2-year-old kids or 3-year-old kids should not be eating that kind of food. Eat whole foods, meat, vegetables, fruit, nuts, and seeds. Occasionally, yes, but Burger King and McDonald's and Krispy Kreme should not be part of vocabulary of a regular diet. And also supplements, always take, if you don't get enough sunshine, take vitamin D, take magnesium, take a multivitamin, and exercise. The best exercise is walking. It's very simple. In America, there's too many cars. I hope it's not the case back home for you.
We're catching up very quickly, but yeah, we do have. Yeah.
Yeah, I love going to Europe. There people walk a lot, and that is really keeping them healthier. So that, and also if there are early signs of pain, use natural things like curcumin or turmeric. Curcumin is an excellent anti-inflammatory. They have studies done on it. It works as well as Advil or Aleve if you take enough of it, and by enough I mean a gram or 2 grams. So I would recommend before you go, even after a workout, if people have sore muscles, do curcumin rather than Tylenol or ibuprofen, because that causes more leaky gut.
Yeah, yeah. So if we had to take turmeric, how would we actually mix it? Would we mix it with milk? What is the best way in taking it?
You can take it in a capsule, or you can make what's called the golden milk with it, yes. You can cook with it. Cooking is good because when you mix it with oil, then it draws out the main component of it.
That's good tips there that you're giving. Thank you for that.
Yeah, you're welcome. You have to, the idea is to come down to using food as medicine.
Yes.
We use the other, the IVs and the stem cells are not permanent. You do that to get you to the other side, and then you continue with a healthy living.
Yeah, that's right. That's right. The natural way, I guess.
Yeah.
Doctor, I know you have a free gift for our listeners. Can you tell them more about that?
Yes. So the free gift is the secret revealed of the root cause. So most often the traditional doctors, they don't look for the root cause. So I have a list of 10 common illnesses and their root cause and treatment, which I'd like to share with your listeners. And it goes from from diabetes to muscle cramps to even for men erectile dysfunction. And I know your program is mostly for women, but low libido would be for the women. So you have to look at the root cause of those and fix it. So I would like to share that. It's a one-page thing that it would be surprising to see what the root cause would be.
Awesome. That sounds really great. Thank you so much for that.
You're welcome.
I'd like to thank you for your expertise and your pearls of wisdom in sharing with us today. I wish you all the best. I know that you are making a difference. I pray that you continue doing it, fighting the good fight with us and helping everyone along the way.
Thank you, and your prayers are precious.
Thank you. Listeners, I thank you so much for listening. I really hope and pray that you have benefited from this, and enjoy the free gift. I think it's quite a pearl to use and take with you into the future. We will chat soon, and thank you for joining us today. Bye.
Thank you. Have a good day. Bye-bye.